Courtney, thank you so much for being on Emotional Support. I'm so excited to talk about your company and how you got here. This is so exciting. For those who are listening, I'm now 10 weeks postpartum. So that's where we are in this journey right now. Obviously, this is going to come out, a couple weeks or months afterwards, but I just want everyone to know like where I am in my journey so then they can follow along or they can feel like maybe my emotions are different and my feelings are different and all of that whirlwind of event. And if you hear my baby or the dogs, my apologies. That's just the life that I'm living right now.
You do not have to apologize. Never have to apologize at all.
It happens. Well, Courtney, I'm so excited that you are here right now. Your company reached out to me and I had not heard of Emagine Solutions Technology. Like, blah, there we go. Emagine Solutions Technology. Mouthful for me. This is my life now. But I was so excited when I started reading up more about it. And I went to the website and reading also all these like really cool testimonials. I had so many questions, but do you want to kind of just like let us know, how did you, decide to start this company? What's your story behind, prenatal, postnatal, maternal mental health? What does that all mean to you?
Well, I mean, so many things. Well, first, thank you so much for inviting me here. And
oh my gosh, of course.
Talk with you. Before I start talking about me, I want to ask, how are you feeling and how are you doing? Because 10 weeks postpartum, that's a real thing.
Thank you so much for asking. That's really sweet. It is a total real thing. I am feeling great right now. I had some complications after the labor. After the delivery was beautiful and ready to go, and I was stitched up and feeling good. Very graphic, but that's true. I actually started hemorrhaging, and it got really bad where they thought I was going to have a blood transfusion. They couldn't understand why I was hemorrhaging. This continued on, long story short, for about 3 weeks. I had to have a hospital stint. They thought they would just give me a pill. It would be fine. And then I ended up having a DNC, 3 weeks, I believe, postpartum, or 3.5 weeks postpartum. And I think that the reason why I'm all like chipper and happy now is I wasn't able to hold my little girl for more than 10 minutes at a time without feeling super lightheaded. And I would like go to sit up to change her, and my mom would have to be there or my husband would have to be there because they didn't know if I was going to faint or not. And also people were not, and that's not fair to say people, but like I had so many doctors that were giving, different messages to me of, oh, this is normal or this is not normal. Come in. There was so much going on that I didn't know. Am I supposed to be like living in a diaper for 3 weeks, like as myself, or is that just my daughter? So I think that I'm so happy now because now I finally feel like myself again. Obviously I'm not Alessandra Torresani, like pre-baby, but I'm feeling like myself where I'm getting up in the morning. I'm excited. I can make food. I can breastfeed her so well. And like, I have just energy again. So yeah, so that's my long story short to how I'm feeling.
Well, that's good. It's always important to check in. I mean, with the patient, you are the one that has been through so much. Everybody's always talking at this point, usually postpartum about the baby, but there's a lot to worry about the patient has been through all this. So
yeah, it's been a lot, and I think it's also, well, one of the things that I'll get into, a little bit later is why I think that your app is so cool specifically, because there were so many questions that I would have had that I didn't, feel comfortable asking other than just the doctor, or I would look up on Reddit, right? That always, and it helped me for my mental health and pregnancy. It helped for physical help. Not really. But there were so many things where I'm like, is this normal? And I kept Googling things, and you would hear other women's testimonials and their stories, but you don't know, is it really normal? Like what's normal in a pregnancy or postpartum? It's not. So that's where I was.
Totally. I get it. Oh, yeah. Well, I'll circle back and answer your question. But so I'm Courtney Williams. I'm co-founder and CEO of Emagine Solutions Technology. And we are tackling the U.S. maternal health crisis with remote patient monitoring for pregnancy care to improve outcomes. So what that really means is we have a patient app that is for maternal health. So this is a place where patients go and they log and track their pregnancy health from positive pregnancy tests all the way through their postpartum recovery. And then we also have a provider portal where providers can see their patients' health trends in real time and be able to follow those pregnancy journeys.
So cool.
So without the patient being in the office, right?
Right.
And then the third piece of this is also our VistaScan, which is an FDA-cleared handheld ultrasound we developed for providers to use during regular office visits. So instead of just hearing the fetal heartbeat at your prenatal appointments, this VistaScan enables the provider in the same amount of time to be able to do a quick look ultrasound and give more diagnostic information to the care team and to the patient.
And I think that it's so important because, I mean, there was a quote and I took a picture of it because I was like, oh my God, wait, I have to say this on the podcast. So don't mind me. But, and like, this sounds like I'm like, oh, I work for the app. This is not like the case at all. I just was like, this is exactly what I needed. And I was like so upset that I didn't find it before because it said the app has eased my anxiety in between doctor appointments that my baby is healthy and active. My anxiety, along with every other mom that I have interviewed on my podcast, that I have met in person, that I have met virtually, that is the key word, I think, is anxiety of the, oh my God, is the baby breathing? Like, my baby didn't kick that much today. Is that okay? There are so many things that cause just strenuous, like, anxiety that you can't even breathe most of the time. And it's weird because now, like, people will say to me all the time, like, oh, do you want to have another baby? And I'm like, whoa, like, let's calm down. But at the same time, I'm so anxiety ridden from holding my breath for 10 months of this pregnancy, just like praying and doing all the woo woo that I could to make sure that everything was healthy. And like every single doctor's appointment you go into, right, you're so nervous. The ease that I would have if I knew before even going into the doctor's appointment, like, it's going to be okay. Like, this is normal. I don't have to wait 6 weeks to ask this question and have it ruminate in my brain over and over and over and over, because that's truthfully a big reason as to why I don't think I would have another baby, because I'm so scared to be pregnant again and have to go through those milestones of the anxiety and the stress.
Yes. Yes. Yes, you are not alone by any means.
Yeah.
Absolutely. The anxiety. So earlier this year, we participated in a program called National Science Foundation I-Corps. And so we got a grant to go interview 100 different pregnant patients and their providers in like a 6-week period. And so we wanted to learn about the challenges for maternal health right now, and also like in general, like the kind of the height of the COVID period, and see what the gaps, like we thought we understood, but we wanted to learn more. And
yeah, of course.
Over again, we learned the same thing, like what you just touched on, just the anxiety piece. Like, maternal mental health is such an area of concern for patients and their providers. And yet there are not a lot of tools, or not a lot of like data-driven ways to manage pregnancy right now that can help bring either comfort or can help bring information that can be helpful to act on. And so that's kind of our thesis with this technology. Like, let's make pregnancy more data-driven. And hopefully by having more information, that will bring down the stress level for people, especially first-time pregnant people, folks that are, older, like I was. You hear every time, like, oh, you're over 35, you're old. There's
geriatric pregnancy. Yep.
Yes.
Love those. Real cute when they say that, right? Yep.
2 favorite words we don't want to ever hear together. Yes.
Now, why did you decide to start working with this company or come up with this idea? Did you have your own personal experience where you were feeling, obviously you were feeling the lack, but what was your experience?
So my first a vision or foray into maternal health actually was seeing my sister go through a really difficult and high risk pregnancy.
Oh, wow.
She was on bed rest. So she's my big sister. She's former Division I volleyball star. Like, she's like the picture of health, right? And then to be told that she had to be on bed rest for months on end to have a safe and healthy pregnancy, hopefully, and which she did, luckily. But the whole process opened my eyes into, well, so she's on bed rest. We got patients on bed rest like her, that it's dangerous to get to the doctor. Yet you need to get to the doctor to find out if you're okay and your baby's okay. Like
100%.
And so there felt like a huge disconnect there. And I was really bothered by this, and I did more research, and I come from a background, business background. I worked in customer analytics at the time, and I was having trouble understanding like why there weren't more technologies to manage pregnancy safer,
right,
in a safer manner. And so that's kind of what opened the box for me. And then as we started with our handheld ultrasound, we got that FDA cleared. COVID hit. I had my pregnancy, and I was like, oh, the missing piece here is really the patient piece. And patients want to be a part of pregnancy, especially us and our generation. We expect to have more communication. And we're hoping that this technology will enable pregnant patients all over the world to be able to do this. So
when you were pregnant yourself, were you writing down certain things that you felt were lacking in like the community and in like the technology world of what you would want, like for your own personal experience?
Interesting, but no. So here's where the problem happened. For me, it was also postpartum. And so I had my C-section, and, a couple days after coming home from the hospital, I started to feel things were off. Like my legs, instead of getting less swollen, were getting more swollen. My ankles were just blown up. I couldn't put shoes on. I was really short of breath to be able to walk down the hallway. It was, I had a headache that was so bad it would not go away. And I was like, this doesn't seem right. Like it didn't feel right. And so I wish I had been able to document those symptoms as they were cropping up. But lo and behold, I mean, if I had had the app that we have now, then I would have known that my blood pressure was getting too high and I was starting to experience preeclampsia. And yeah. So that was sort of like the impetus for like, okay, there's a communication piece here that we can open up. Because being able to document your symptoms and your vitals, like your blood pressure, your weight, your temperature, if you're diabetic, like your blood glucose, and be able to communicate those right away to your doctor without, like, in my case, after I went through that experience and after I had recovered from preeclampsia, I still had to go into the doctor's office and have them do a blood pressure check in those weeks postpartum. I'm like, this is like 35 minutes away from my house. Like I've got to, childcare. Like you don't want to leave your baby after you just gave birth.
No.
You know what I mean? So having this kind of tool to be able to communicate that to your provider, like, so we can avoid office visits that maybe are not as necessary. That helps also alleviate the stress of the provider. They don't need more patients coming in. They're overwhelmed. So
no. And the other thing is, I think there's a few things like that's actually really cool about it too, as to why I'm like, oh man, I wish I would have, jotted it down and had that with my provider. But, postpartum, right? They kind of see you after 6 weeks and then it's like, peace out. Like, it's been fun. It's been real. Enjoy your life with your child. Like, hope it goes well. And I think that I did not have a C-section. I had a vaginal birth. And I thought, oh, okay, great. Like after this is done, like I go in 6 weeks, signed, sealed, and delivered. Like I'm not quite sure how it was for C-section. Like if you go in a little bit more than that, because you obviously have stitches and stuff like that. No. So but I was like, oh, for me, I'm like, oh, okay, it'll be easy. But when you're bleeding so much and all this stuff was happening to me, I would be like, I think it's normal. And my mom would be like, I never bled that much when I was with you, but I don't remember. And then my husband's like, no, this is terrifying. Like, this is really scary. And I'm like, you're just being a baby. Like, you're overreacting. It's fine. But inside, right, you know that something is seriously wrong. But having to wait those weeks. And then when you call and they're like, no, you're fine, because those providers doctors must have people call every single day after postpartum being like, something's wrong. And they're like, nothing is wrong, honey. You're fine, And it's like, you don't want to be the difficult patient and you don't want to be the needy one. And you're like, that they're kind of done with you, right? Once they deliver your baby, you feel like chopped liver, really, and you're like, well, that was it. Like, we're done. And so I think that that's scary. And then I think another thing, is is when you're going through your pregnancy. I know for me, I was really lucky because once I started talking about it more in the end of the second trimester, beginning of third trimester, that's when I was really being open about it in interviews, like not in the public, but I would interview people for future. And being able to compare notes was really cool, you know, but I hadn't experienced that before, and I wasn't writing things down as much as I would have liked to have written them down of physical symptoms. With my mental symptoms, I had to, living with bipolar disorder, but the physical I didn't. And this would have been such a cool thing because it would have relieved that stress in between the doctor's offices. Like, I mean, and I know, like, sorry, I'm like going on a ramble because I'm like, this is the fucking coolest app. But like, I like, the other thing is like, I went to a specialist, right? You have to go to like a secondary specialist to make sure everything's okay. I don't know if you had to do that. I certainly had to do that. And I was a nervous wreck going into that one because it's like meeting a brand new doctor, trying to impress them and being like, I'm good. I'm healthy. I'm not smoking. I'm not drinking. Like, not that I would do that anyways, but I mean, like you get so overly nervous, right? And like self-aware, where I don't think I would have been that stressed out and caused that much anxiety, which then causes anxiety and stress on your baby.
Absolutely. Totally. Yes. Like over and over again. Like actually, I heard that from my provider. I don't know if you had those conversations with your provider, but it's like, and the people that are on our app now are like telling us this too. Like, you know, the hierarchy between patient and doctor is real and it is intimidating. And it's sort of, according to some of the expert OBs that we work with, it's sort of a relic of the past. Like we're trying, like OBs are trying to like move forward from that and have a more like two-way dialogue system kind of.
Right.
But the hierarchy in itself causes stress and it makes patients sometimes feel rushed or that they don't have the forum to ask their questions. And, you know, it can make those 7 or 15-minute office visits, which is all we get, right? It can make that even more stressful. And of course, there's always impact on the baby, which you're absolutely right about that. I've heard that over and over again from my provider, like, don't stress. But when somebody tells you not to stress, does it make you want to stress? Right.
Yeah, no, totally. And what is going on, you know, so I live with bipolar disorder and I actually got off my medication before I tried to get pregnant. I got pregnant right away, which was wild to me. I was not expecting that. And I'm currently breastfeeding, so I am not back on my medication yet, but I, you know, plan on getting back on once I finish. And that was my own journey. That's not anyone else's. That's not a doctor recommendation. That's just what I did with my doctors. But do you have a lot of women that are talking about their mental health in regards to medication and stuff on your app? Is that something that's talked about?
Yeah, definitely. I think the issue is sort of like how can you quantify like mental health, like so that you can see trends in yourself and determine like where to pinpoint to your provider specifically like, where like help is needed. And so like this is definitely like an ongoing conversation, like in the femtech, which I don't like that word, but femtech industry. And this is a conversation we're even having like in our own team as well. Like, how can we provide better maternal mental health support through pregnancy? And so the kind of like phase one approach of that is mood tracking. And then obviously like being able to have a forum where you can text your provider on our app with quick questions and the provider then gets a ping and can respond back. And so but then that's not going to be enough, obviously, like long term, like being able to like track like medications and things like that is important, and understand if there are interactions and like what the indications are for pregnancy versus not. So I think right now, like at least from our perspective, like we're managing that through better messaging capability with the provider. And I think in the future, like having I guess more data driven way to track mental health through the pregnancy journey is where we want to go. But nobody's there yet.
No. And I think that that's one of the hardest things that, you know, so many people that I've talked to that are in the tech world, right? And even, you know, one of my best friends is a neuroscientist. And so he and I, you know, and he lives with bipolar disorder as well, but he's obviously not the one getting pregnant, but he knows so much about this. And he is like, unfortunately, there's a lack of research when it comes to pregnant women, just in general, like forget about mental health, just in general. It's just a short, period of time that they can do the research, finding women that are willing to do research while they have a baby inside them. Like there are so many factors that you kind of just have to do a risk assessment of yourself and like be like, what do I feel comfortable with and what's going to make me the most settled and the healthiest for my baby kind of a situation, but I think that that's so important to have apps like yours where they are tracking the moods, because there were so many times in my pregnancy where I had recognized the mania of bipolar disorder. But then also I'm like, oh, but wait, if I share this story, I have other people that are writing me and going, oh, no, I don't live with bipolar disorder. I'm just fucking pregnant. I'm just feeling this, you are feeling all the hormones and all the emotions. And I think I know right after I gave birth, I was so prepared to have postpartum depression because they, will say like the percentage of those living with bipolar or mental health, mental illness prior will have a higher percentage of getting this. I don't know what it is. I'm not saying that because you can still get it after you finish breastfeeding. So I'm still breastfeeding. So in this moment, I have not had postpartum depression. I've had signs of it. I've had those dark thoughts in the first week, I would say, and from what I can tell, it's very, in quote unquote, normal to feel like certain things that I was feeling, you know what I mean? Of the fear of like, oh my God, am I going to let go of the stroller? Am I going to drop the baby? Like certain things like that. Everyone's like, nope, that happens. There's the baby blues, as they say, for some of it, and then there's like the more extreme. But I think I was so focused and so physically like completely just a disaster because I was bleeding so much that my mind couldn't even go to a darkness of postpartum depression. And I think that there's like kind of this like blessing in there in disguise that I don't know if that's what happened or not, but for me, that was like my kind of, good. It was like kind of the best thing that happened in that way, because I was able to not focus on that. But I think that that's really scary for so many women. And I have interviewed so many wonderful people that work in the postpartum depression, specifically in that field, that have the resources and the websites and the communities and stuff. But let me tell you, it is a thin line of wondering, like, do I have postpartum depression? Are these thoughts normal? And I'm sure like something like your app could be able to identify of which is which, you know what I mean? And not like 100%, but you have the opportunity to talk to your provider like that, right? Because when those thoughts are going through your mind, they could happen at 3 a.m. and you're like, well, can I just shoot a quick email to the provider and be like, is this okay? Because that's what's really scary. And that's when you feel so lonely. I would say in the first week of postpartum, right? You're like alone with this baby and you're like, what is this alien that just came out? Like,
and how do I take care of it? And how do I take care of me? And like, what do I do? Oh yeah, definitely. Yeah. I would mention also, like, I didn't know about this before. This is, I think, fairly new. I don't know the exact time frame when it came out, but HRSA, so the Department of Health and Human Services, they folks have probably brought this up on to your community before. They have a new maternal mental health hotline that anybody can call 24/7. And
I did not know this.
Yes. This is a totally amazing resource. It's called the Maternal Mental Health Hotline. And anybody is available to call. It doesn't matter if you're rural, whether you're urban, it doesn't matter where you're located. Since like 49% of US counties do not have a practicing OBGYN, this hopefully can help fill the gap, especially for mental health. Yeah. And it's available for patients, prenatal care and their postpartum journey. And so I would definitely like say to your following, like that this is, I think that's like one of the single best resources that has come about that is reliable. And it's also not necessarily like a tech solution, because some of like the like the mental health apps where you can talk to a therapist and stuff, there's still kind of, there's an issue of like data harvesting that's going on there in the background. Whereas, you know, like you call the government hotline and it's, when they say it's confidential, like it's truly 100% confidential, and you can talk to somebody and get help in crisis, or even if you don't know if you're in crisis, like right then and there.
Yeah, right. Because I mean, that's the other thing. It's like, how do you know if you're in crisis mode? And I think that's because, and that's what's so hard. And that's the whole story for an entire pregnancy and postpartum journey. It's like how do you know if you really need that extra bit of help? Mm-hmm. And I think that happens so often, and people are afraid of doctors. I mean, I know that I had a really tough time with doctors. I don't trust doctors, like, because I had been screwed over so many times by certain doctors with my mental health, that really it takes me such a long time to just feel that like comfortability. And I think it's so rare. Long story short, my OB passed away about 3 weeks before my delivery. Just suddenly he just passed like that out of nowhere, unexpected. And he was just like God's gift to the world. Like he was the best thing in the entire world. Like love Dr. Jay Goldberg. Like can't speak highly enough about him. And it took me so long to create that relationship with him. Right. And when you find that OB that you connect with, you are there. They are your right hand. And he was someone that went the extra mile to constantly make light of a situation, always laughing, always making you feel like you're not crazy. Because I think so many of these doctors. And when he passed, I had about a week and a half, 2 weeks to figure out who my doctor was, because baby was coming in 2 weeks. Like that was when I think my 39 week, I think he passed at 37 weeks. I think that's when it was, or 38 weeks pregnant, and I was like, oh my gosh. And I had trusted everyone at that center where I knew if someone had to deliver, lady, it would have been okay. But I was like, oh, whoa. And what you do realize, and what I realize now, having given birth, is the importance of the doctor pre-labor. I think that's something that I love to just now shout to the rooftop since experiencing this, is you really need to find someone who's going to listen to you, that's going to answer the questions and be there as a support system. Because when the baby comes, like, your nurses are the most important. It's your people that you bring with you. The doctor's kind of just there just to like catch the baby or like cut open the baby. You know what I mean? Like be there in the emergency. That's not the support system, but you need that support system throughout the whole time. And when I was interviewing other doctors, I was really lucky with the 2 that I had found at the end, but the other ones were just not that like, I was someone that was like, I want to wait naturally until she comes. I don't want to be induced. And I was like, when she's ready, she's ready. Like, let's go from there. And there were so many doctors that were like, that's sweet, but like, that's not happening. And I was like, but that's not respecting me. And then I felt like that insecure little kid again, that's like in first grade, like afraid to raise my hand and ask the question, So there's so much of that that's going on. And so to be able to find a doctor or a group or a center or a midwife that you connect with, I think is the most important thing for the whole journey. I think that's how you have to think of it, is like, who's going to be there to answer the questions and be there for you, and that's what's so awesome, with the app. I think that's so cool that you can be able to text the providers. Now, are these providers, like, is it everyone on a certain network? Like, how is it that what are the providers that, like, does that make sense? My mind's not working. Do you know what I mean? Okay.
Mm-hmm. No, totally. So actually this is what we hope is all providers will be on the platform eventually. Cool. Because that really opens up the world to patients, frankly.
Yeah.
But no, this is actually just providers. So hopefully when you sign up for the app, your provider is already in,
Great.
is already in. Ask, like, when you become pregnant, start using the Journey pregnancy app, like, ask your provider if they have the Journey as well. And then that's where you can set up that connection with your particular provider. That's
awesome.
That you text with. So yeah.
Wow.
So that's our hope. We hope all providers will be on there, but it's new. And so, gotta hopefully see if everybody will will jump onto the platform.
What's something that was in your pregnancy journey that you maybe learned or you discovered or someone had taught you that you really like stuck with you that you love to share with other moms like through your app?
Oh boy, lots of different things. But one of the things that stuck out was just, there's so much to learn about your own biology as you're going through this. How many like biological things are happening? Like I found really fascinating. We didn't really necessarily get time to talk about that in our doctor's appointments at all. And
Right.
I'm like, oh wow, okay. So for example, like foot size changes, like your foot can change, like or can expand like 2 to 10 millimeters, and that change is permanent. Like what? Like that's fascinating.
Why do people know it? I was like, not everyone's like, oh, your ankles are going to get swollen. I can't wear any of my shoes again. Like, this is bizarre.
Yes. And potentially permanent and likely permanent. Like those types of things, like having.
I didn't know it was permanent, Courtney. Why are you telling me it's permanent?
Cat's out of the bag. May not be. Maybe not for everybody. Like I was like going through and like reading PubMed articles, and on NIH and stuff. And I think one of the things about this is just like the interest in like our own biology and wanting to learn more. And so that's why we incorporated a pregnancy tip of the day. Like every day when you log in your health information, like also like get a pregnancy tip, like that's data driven, that's from a reliable source like the NIH or like CDC or from like peer reviewed medical studies and journals, like to learn more about what you're going through and like learn more scientific information about pregnancy. So that was like the biggest thing that stuck with me. Like I think we all love to know that you're 30 weeks pregnant and your baby's the size of a cantaloupe, like or melon or whatever, cabbage.
Right.
I think it's entertaining, it's fun, and there's and
sure,
and the fun element, right? But like, what is that doing for your maternal health? Like, not much. Like getting biological information, understanding like what's happening to your body, not just your fetus or your baby. Like, I think that is helpful to people, and maybe can also help reduce anxiety. When you know more, you are
totally
empowered.
Well, like something that happened to me is, and I don't know if it happens, because my daughter's head came out of my vagina. Like, don't mind me to be super graphic, but that's just the truth. But my hips like got so much wider, right? And they're like, and then I did belly binding afterwards because I was like, oh, I'm going to do this practice of belly binding. I don't know if you know what belly binding is, but it's basically like this old like process. It's so beautiful, and I highly recommend to moms. But basically, they bind your whole stomach from your ribs. They do like a womb massage, and they massage everything, and they bind your stomach. And it's not to like make it, it's not to make you skinnier. It's not to like snatch you back in place, but it's basically to hold your organs in place, after the massage, because no one talks about the fact that your organs and your hips and everything gets like smushed and all over the place, and then it doesn't get just back to normal. And so a lot of people will just like do a waist trainer or just do like a corset type top, but sometimes that's not great for your pelvic floor. And then your pelvic floor gets like completely messed up. Like for me, like I am totally open and honest. Like I have to have PT therapy, pelvic floor therapy all the time because I constantly am peeing my pants. Like my incontinence is out of control, and it's like super embarrassing. And like I can laugh about it, but it's like at the end of the day, it's truly this thing that I was like, why is this not going away? And why did no one tell me about this? And I had to find it out through the woman who was doing my belly binding. And then I went to my doctor and I was like, by the way, this is happening. Can you help me? Like, why was that not talked about beforehand? Like, you may have incontinence and you're going to need pelvic floor therapy, right? Something that was not talked about. And it's not, I guess, my doctor's fault, but I mean, that should have been something that I think was top of the list. Like, this is what happens, and most women have to go through this.
Which, like, sorry you're experiencing that, and like, thank you for talking about it, because like, it's so it's interesting, just like coming back to like full circle in general, like macro view of women's health. There's so many women's health topics that like society has somehow deemed taboo, and that it's not okay for us to talk about these things. And then like in the not okay to talk about, like we lose information and like knowledge of of the questions even that we need to ask. And so like by you talking about your experience like that, I think really helps other people. Like it kind of goes back to like, is this normal? Like am I the only one experiencing these things? Like, I guess I'll point to another example of something that happened to me that maybe happens to other people too. Like in experiencing preeclampsia, in my case, in the postpartum period, I learned that this increases my chance for heart disease eightfold, like 8 times more likely to have issues of heart disease. Yeah. And so like, yeah. So again, like that was like one of those things that didn't come up necessarily in my doctor's appointments. But I was trying to learn about it myself. And then I hopefully tried to ask the right questions, but being in this field, I was a little bit more exposed to, different conditions and things like that. But yeah, I think everybody probably has this like aha experience that they're like, oh, I didn't know this. And to maybe be able to coalesce a little bit more knowledge around that and the bringing down the taboo, I think is so important. I'm really glad that your podcast exists. I'm glad that you are so open and honest with your following about what you experience.
I feel like I'm a little too open, if I have to be honest.
No,
you're like, we don't want to hear about you peeing your pants, but it's like a thing. And other moms, like, I've been very lucky because I have a lot of moms that I'm actually really close friends with that all gave birth around the same time, which was really cool just by random chance. But also meeting new moms, it's embarrassing. And you're like, did this happen to you? And like, you're like, oh, and I think that it's the same thing with mental health, right? It's like, it's always been taboo, right? So it's like, why not just like talk about it? It's not just the maternal mental health, it's maternal health in general. And I think that the more this conversation is brought up, it's something that we can just bond over and not be, thinking like, oh, is it just me? Because I just know there were a lot of moms that I would share my experience or they would share their experience. And I would go, oh my God, I thought I was just experiencing this. Like, it's not, and I'm only 10 weeks postpartum. I'm not even like through it, and according to, science and doctors, after 6 weeks, you're good to go. Like you can go and, and I think the craziest to me was my doctor, when I went in there, so great. But like his biggest concern, that my new doctor, the biggest concern was like, we have to get you on birth control because it's not healthy to like have a baby right away, all this stuff. And I was like, I can feel stitches. I feel pain and I'm peeing my pants. And it's like, why are we not talking about like, that's where like, forget about putting me on birth control. Like it's not happening.
Yeah, definitely. Yeah. That is also very real. Very real.
Yeah. And I think that it's like a real, and I think a lot, and it was something that happened to me. And maybe this, you can maybe this is talked about on the app too, where I think a lot of women, another taboo subject is, a lot of women, right? I don't know if they're not open with their partners or whatnot, but the doctor literally said to me, 2 doctors said this to me. They were like, if you're not ready to have sex yet, you can just let your partner know, doctor's orders. And I'm like, pardonnez-moi, like let my partner know that my doctor said this. Like, no, I'm going to say this. But it made me kind of have this weird feeling like, oh, wow, there are so many people out there that just like don't respect their partners just giving birth to a human life form, like that comes out like an alien, and they're just like, no, but like, I need to satisfy my sexual needs first. Like this is happening. Like, and that was the concern of, the having sex, like if you're not comfortable or why you should be on birth control. And I was like, this is terrifying that this is such like it was so common the way that the doctors, plural doctors, said this to me. I was like, oh no, my husband is not going to be touching me unless I like am okay with this. But it's something that like obviously it happens enough where they're letting them know like you can give it as doctor's orders. Like, is that talked about ever with the community on your app?
Well, it should be talked about more. I mean, a little bit, yes, but not enough. And I think here's like back to like broader conversation about like women's rights and like, the what we can and can't talk about in society. I mean, the issue of like domestic partner violence, like or just not feeling safe at home, or not being in a situation where you that's conducive to like your like health, happiness, and like mental health and emotional and physical well-being. Like
right.
that is that is something that like I think more doctors are incorporating, like the whole social determinants of health. Like I think that that conversation is starting to like bubble up to the top more, but we're safe at home, or you don't feel comfortable bringing up the fact that like you're uncomfortable getting pregnant again right away, or you don't feel like you have bodily autonomy, or like you are just not in a safe place. Like the one of the best people to bring that up with is your OB, because I mean you're absolutely right. Like that's that's your women's health. That's like community health.
Yep.
That's your family's health. Like your family's health depends on your health as as a woman, as a mom. And so
Absolutely.
bring up your doctor. Yeah.
Yeah, absolutely. Because this was and when they said that, I was like, oh wow, this must be a concern or something that is concerned with other women and households. And I was so overwhelmed. I was like, what? I was like, no, I don't need you to tell me. Thank you so much. Like, I got it. But I'm like, there must be so many women that are going through this. And then my heart was broken and I was like, oh my God, I can't stand this. Like, what can I do to help out? And it's just, it's this never ending, I feel like, circle of, and then, what if you wanted to have a kid right away? You know what I mean? And then they're like, oh, it's not healthy. And I'm like, but why? But then I didn't want to get into any of that because I was like, I don't want to do that right now. Like I'm still so traumatized, but that's another thing, right? Like I experienced so much trauma that blood now triggers me, right? Like it makes me, every time I look down, like in my diaper, 2 weeks postpartum and there was blood, it made me go back to the traumatic birth. And I was like, oh, wow, this is what PTSD is. Like, that's fun. Like, here we go. Like, let's just add this along, and I'm lucky enough to have therapists and doctors that I can talk to, if I needed, but that's something, right, that's not readily available as well, and then you also feel like on a lot of the apps, for pregnancy and like the what to expect when you're expecting type of things, right? They stop at 42 weeks, some of them even stop at 40 weeks because they assume that you have your baby, early if you want, and I think that that's scary too, right? Because then you feel like lost all over again and that little support that you had, it disappears. So I really do appreciate that yours, that you're thinking of not just the natal, you're thinking postnatal as well, like and maternal mental health and the postpartum and all of it. Like it's just so important, it really is. And I love what you're doing and I want to thank you so much for that. And I just can't wait for it to continue to grow. Is there anything else that you would like to share with the Emotional Support Group, about the Journey Pregnancy app or about the technology?
Well, I will share that this is, so while we won a number of awards and grants, this is new and this is something that we want to evolve as we all evolve, like as our society is evolving, as we're having better conversations about maternal health and like maternal mental health. I guess what I would say to all of your followers and your members of your community is like please like try this out and give us feedback. Like we want feedback. We want to actively as a community like make this better for people that are going through a pregnancy journey. And so like this is, I don't subscribe to the thought that like technology is done, it's developed, it gets out there and then that's it. I believe in an open conversation and making things better and like evolving and developing something that ends up being the best tool because there has been a lot of feedback and a community support around it. So I would say use it and then contact me. We're on social at Emagine S Tech on Instagram and on Twitter. And we're also on LinkedIn too under Emagine Solutions Technology. Like connect with us because like we are a small team behind this and we're open and we want to hear from you. So
I love that. Yeah. And then I have to ask you, Courtney, what is your emotional support? I'm getting the hard-hitting questions on you.
Right. Well, so my emotional support is I've got I'm so fortunate. Like I've got an amazing toddler now, and I'm his emotional support, but in some cases he's my emotional support. And I've got a great partner who brings opens my eyes to study different worlds of knowledge that I didn't know before. We're he's from a different place and a different culture than I am. And he is a great emotional support to me. I'm very grateful for him. And also, I have a rescue dog who's like back down here. And she's my emotional support. She's a senior golden retriever we just adopted this weekend.
Oh my gosh, just this weekend. What is her name?
Her name is Lulu.
Lulu. Oh my God, I love senior dogs so much.
Yeah. So anyway, Lulu is an amazing emotional support to us all. Hi, Lulu.
Oh my God, yeah. Lulu is an angel.
She really is. Yeah. So that's my emotional support.
Oh my gosh. Well, Courtney, I can't thank you enough for contacting me, and I wish that this would have happened sooner. I wish that I would have, gotten a hold of you, but I know you're going to help so many women out there with your app and just with your support and the community. I think the more we can just share our stories and the more we talk about it openly, the grossness of it all and the truth of it all, I think it's just, it warms my heart, because I know there's so many women out there that have these questions that are just starting their pregnancy journey. Or those that are listening who have accomplished their pregnancy and their postpartum and may have an 18-year-old at home now, or a 35-year-old, who knows, but they can help others or their grandkids or whatnot, or their children. And I think that it's never ending. I know that. So we're always making babies. And so I think that's what's so